Oh, the patients are thrilled that I'm doing this. There's no doubt about that. You know, I'm a periodontist, so for years and years I was treating patients with traditional flap surgery. And those patients, you know, although I feel like I did a good service for them, there was complaints of recession, of sensitivity of the teeth. It's a difficult procedure, flap surgery. This is much easier for the patients. Their healing is much quicker, much less post-operative pain. The patients are extremely happy, and I remember back when I started boot camp with Dr. Yukna, so he mentioned the phenomenon of maybe some patients that we had done half the mouth traditionally, and now you're coming back with a laser and you'll do the other half with the LANAP, and they'll see those will be the few patients that'll see the difference, and I in fact did experience that, and all those patients were, you know, super thrilled. It's a much easier process for the patients, and frankly for me as a provider as well. It was a comprehensive training. The first 3 days were intense, but I think it was a good overall introduction to lasers and to the LANAP protocol in general. I think this is an interesting way to do it, to have the 3 days and then 1 day 6 months later and then 1 day 6 months after that. You know, that's not typical. Like normally when you'd go to training for whatever process, you would just get it all in once and then you're out on your own. I think there's some value here in coming back and kind of getting a review built into it, and then kind of being able to talk to the other colleagues and sharing their experiences and your experiences, and just making sure you're getting everything right. I think it's a good way to do it. There was one particular, an older gentleman who really had a pretty good healthy mouth, but there were a couple issues that had just severe infections, pus and bleeding, and just really not good, but just in a few areas. And we were able to treat him with the LANAP protocol, and he responded really well. I mean, just no issues, healed really fast, really quickly, and all the disease was gone. You know, and I think it was just so easy for him and so easy for us, and it was great. I mean, I guess overall, what I'm most surprised is the ease of it from my end of it. You know, it's the fact that it's a simple, relatively simple procedure. It's predictable. It's kind of the same thing over and over, as opposed to when you get into a flap surgery and you don't know necessarily what you're going to find or how it's going to go, how the bleeding will be. It's just I was surprised really to see how straightforward it was. It's very easy for patients to say yes. I feel like we're saving them money, because instead of them doing scaling and root planing and then coming back and then doing surgery, we're just doing it all at once. So we're able to keep the cost down for the patients. I think we're getting good results. You know, I'm excited to be able to offer the procedure. You know, I think it's a great marketing tool. I think it's a great benefit for the patients. I think it's a win-win.